Hi everyone, myself Saranya, Assistant Professor from SNS College of Allied Health Science. Today we are going to see a topic on waste disposal collection of used items from user area. This comes under a topic of CSSD workflow practice, return of equipment and initial processing. So now we are going to empathize what is the heading is about. This is understanding the user area needs. If you are in a hospital, what will you think? You have to be secure, you have to be safe, you should not get any other further infection from others. These are the motive thinking of each and every patient as well as attenders. And the motive of the healthcare providers and the doctors and the team is to give a proper treatment to the patient, to have a safe and security for their health even too. This can also be habitually safe when you do a proper returning of the used equipments from the user areas. The importance of safe collection of used items from the sources like wards, OT and ICUs. The infection risks and contaminated concerns are much higher when you transmit any used particles from this area. The user area challenges are segregation of the waste, timely disposal, handling a heavy or contaminated materials from the user area to the disposable area or a washing area. What could be the problem statement is, if you take an instrument on the way as such without closing it or without having any proper secured bag, that will cause an irregular collection and the infection can spread throughout the hospital or to the adjacent persons who is nearer to the waste. The need for a systemic disposable collection protocol in CSSD is mandatory and that has to be followed properly. The goal is to ensure a safe, timely and effective transport of used items to the CSSD department. The designing a collection process. Using a puncture-proof resistant containers for contaminated items, especially for the syringes and the glass vials, ampules. Why? Because we are breaking an ampule, that particles can shed down and it can able to damage the other person. Or if it is a syringe, it can able to cause a needle prick injury. So to avoid all those circumstances, the used needles has to be properly, securely transmitted into an collection bag. And the scheduled collection times and the trained CSSD professionals is needed for proper transportation to avoid any other further problems. And the segregation of the linen, instruments, sharp and the waste at this point is very much useful. Why? Because from the ward or from the OT, it has been transmitted to the other area in a proper way. What could be the collection workflow, or how would the person to be there for collecting an equipment? The person has to wear a proper protective equipment, that is called as personal protective equipment, can be used by the staff. It has to be an sterile and a protective attire. For example, you can see in this image, the person has been wearing a cap, goggle face, surgical mask, N95 mask, shoe cover, gloves and everything. So as this is a protocol for taking the instruments. Why? Because the CSSD technician also has to be very safe of not contaminated by the equipments or by the contaminated organisms. Removal of the gross contaminated at the source before collection and the use of a designated trolley or bins, secured covering of items during transport. This is very much important. Why? Because you are transporting a highly infectious material through the wards or through the bay or corridor of an operation theatre or somewhere. There will be so many persons will come in contact. Either it may be a patient or attender or a healthcare providers. So it has to be in a secure transport pathway and also in a closed containers. Separation of the cleaned and the dirty pathways has to be defined. How can we do an implementation and monitoring of doing all these things is routine audits of collection timeless and the container integrity, and the staff compliance is checking for an hygiene and protective gear usage, feedback loop from the user areas for the process improvement. And you can use and collected bins like this, color coded bins can be used, so that these bins can be helpful for us to be segregating an instrument. For example, if you are using an cytotoxic waste, that can be used with the help of an black color bin. If you are using an contaminated organs or contaminated fluid waste or the human waste, that can be disposable with the help of an yellow bin. And if it is in plastic or a glass waste or a broken waste, that can be disposable with the help of blue. and also the certain soaked items can be disposable with the help of RID. So this protocol will be pasted all over the areas of the hospital to monitor the exact segregation of the waste. And collection of safety measures. Avoid overloading of the containers or trolleys. Heavy instruments placed at a trolley at the bottom for safety. Cleaning and disinfection of the collection equipment after use is also an important factor. The waste disintegration or the disposable is occurred according to the color-coded segregated biomedical waste bags. Secure storage of the waste awaiting for final disposal, and coordinate with the hospital biomedical waste staffs or the disposable vendors who will be taking the waste from the hospital to a secured area. This has to be monitored. Benefits of having a structured collection process is reducing an infection transmission risk, enhancing an effectiveness of CSSD operations, and complies with an health and safety regulations with the guidelines. This is helpful for us. And final summary of what we have discussed is understanding the user areas, define the problem, designing and collection process, and your collecting workflow or collection workflow has been done as a prototype, and implementation and monitoring of exactly what we are collecting from the user area is to be monitored, and collection safety measures, waste disintegration or segregation and disposable to be done, and this gives you a structural and collection process. Thank you for listening.